Hello everyone and welcome. Today we're tackling a topic that's causing real financial pain for seniors across the country, the shocking rise in Medicare supplement premiums. If you've opened your mail recently and seen a letter about your Medicare supplement plan premiums increasing, you are absolutely not alone. We're seeing massive rate increases, some of the worst we've seen in years. If you're living on a fixed income, you already know this isn't just some minor frustration, it's real financial strain, and it can hit harder than most people realize. So what are we going to do today is walk through exactly why these Medigap rate increases are happening, take a closer look at who's feeling the impact the most, and most importantly, go over what steps you can take to keep your coverage strong without throwing your budget off balance. So let's get right into it. Why are your Medicare supplement plan premiums exploding like this? Well, there's a perfect storm of factors driving these unprecedented Medigap rate hikes. Soaring healthcare costs. This is a fundamental truth. Everything from hospital stays to medical equipment is simply more expensive. These higher costs get passed directly to your insurance company and then inevitably to you. An aging pool of policyholders. People are living longer, which is great, but it means the risk pool for many Medicare supplement plans is getting older and potentially sicker. Here's what's important for you to understand. If you're in a plan that's mostly made up of older members and there aren't enough younger, healthier folks coming in to balance things out, you're probably going to see your rates go up more quickly than you'd like. Take Plan F, for example. Since 2020, it's been closed to anyone new joining Medicare, which means the group of people in that plan is getting older each year. And that aging pool is driving some pretty steep rate increases. The post-COVID rebound effect. Now, there's another factor at play here that's worth pointing out, and that's what some people call the post-COVID rebound. During the height of the pandemic, a lot of people, understandably, postponed doctor visits and procedures they would have normally taken care of. Fast forward to now, and we're seeing a wave of folks getting caught up on all that delayed care, which has led to a noticeable uptick in claims across the board. Insurance companies are paying out more than they anticipated, and they're compensating by raising your premiums. Aggressive pricing strategies gone wrong. Many new insurance companies jumped into the Medicare supplement market, often offering unsustainably low introductory rates to quickly gain market share. The problem? Well, when they had to raise prices to cover losses, the healthier people often switched to cheaper plans, leaving a sicker, more expensive group behind. This forces even higher rate increases for those who remain in the plan. This charter rotation strategy is causing chaos in the market. Changing state laws, the birthday rule. This is a huge, often misunderstood factor. In some states, new laws like the birthday rule or anniversary rules allow you to switch Medicare supplement plans each year without medical underwriting. While it sounds beneficial for you, it has a significant downside. It drives up rates for everyone in that state. When insurance companies can't use health questions to manage their risk, they have no choice but to raise rates across the board. Maryland, where we're based, is one of these birthday rule states, and Virginia has recently adopted a birthday rule earlier this year. It's important to remember that other states where the birthday rule has been in effect longer tend to have higher overall Medigap rates and larger rate increases. So who's feeling the rate increase burn the most? Well, if you're still on Plan F, you're likely seeing some of the most dramatic increases, often 10, 12, 20, or even 38% or more in some states. As mentioned, its risk pool is aging rapidly. Plan G isn't immune though. Many are reporting average of 5 to 10% rate hikes, and some are seeing as high as 15 to 28% rate increases in certain states. Plan G is currently the most popular Medicare supplement plan and is experiencing some of the highest loss ratios compared to other popular plans. Even Plan N, which generally has lower premiums and tends to see smaller rate increases than Plan G, is experiencing increases. While still a good option, the gap in increases between Plan G and Plan N is narrowing in some areas. Your specific location, whether you're in Maryland, Pennsylvania, Virginia, West Virginia, or practically any other state, significantly impacts your rate increases. The good news is you are not stuck with these escalating premiums. You have powerful options. Unlike other Medicare plans, Medicare supplement enrollment is year-round. This is your superpower. Don't wait for another rate hike. You can compare plans before enrolling by looking at the insurer's rate increase history. Also, consider switching plans or even carriers. If you're healthy, in most states, switching plans outside your initial 6-month Medicare Part B enrollment window means you'll face medical underwriting, which is basically nothing more than you're answering some health questions. And if you can pass, you could switch to another company offering the same Plan G benefits at a significantly lower rate. Explore Plan N. If you have Plan G or Plan F, switching to Plan N could save you money. Plan N usually comes with a lower monthly premium, and in many cases, its rate increases are a bit more stable over time compared to what we see with Plan G. Now, the big difference between the two, and it's one that often gets people hung up on, is that Plan G covers what's called Part B excess charges, while Plan N doesn't. But here's the thing, those charges are pretty rare, and they're actually not even allowed in certain states. The other key point with Plan N, you might pay a small copay here and there, maybe like when you go to visit the doctor or you go to the ER. Still, for a lot of folks, those trade-offs feel pretty reasonable when you look at the savings on the premium side. Leverage state-specific rules. In Maryland, the birthday rule allows you to switch Medigap plans around your birthday without medical underwriting. This is a massive benefit. For our clients in Virginia, this rule was passed in late spring 2025, offering new flexibility for them. Other birthday rule states include California, Idaho, Illinois, Kentucky, Louisiana, Nevada, Oklahoma, and Oregon. In states like Pennsylvania and West Virginia, though, medical underwriting is typically required if you're switching outside your initial enrollment period. So being in good health is key. At any point, if you're feeling unsure about your options or just want some clarity around what's allowed in your state, Senior Benefit Services is here to help. We can walk you through the rules specific to where you live and help you figure out if switching plans is even on the table for you. Now, let's say your Medigap premiums start creeping up to a point where they're simply not manageable anymore. It happens. In that case, it might be time to look into Medicare Advantage, also known as Part C. These plans work a bit differently. They take the place of original Medicare and often come with lower monthly premiums, sometimes even zero premium. And they usually include extra perks like dental, vision, hearing, and prescription drug coverage all bundled in. That said, it's important to go in with your eyes open. Medicare Advantage plans typically use provider networks, which means you'll need to stay within a list of approved doctors and hospitals. Plus, getting certain services may require pre-authorization, so there's a bit more structure involved compared to Medigap. Last but not least, Medicare Advantage plans are what we commonly refer to as cost-sharing plans. This means that you are basically sharing the financial risk with the insurance carrier by paying such things as co-payments when you see a doctor or have a larger daily copay while you're in the hospital. Don't try to navigate this complex landscape alone. This is precisely where Senior Benefit Services becomes your most valuable asset. We are licensed independent brokers, meaning we work for you, not the insurance companies. Our service is completely free of charge, and we are licensed in over 40 states. Some of the things we can help you with include comparing all available Medicare supplement plans and companies in your area to find the absolute best rates for your health and budget. We demystify medical underwriting and help you understand your eligibility to switch plans. So take a moment to really look at the coverage you have now and ask yourself whether a more affordable option, something like Plan N, might make more sense for where you are today, both in terms of budget and what you actually need. We'll take the time to walk you through the Medicare Advantage options step by step, breaking down how the networks work, what kind of costs to expect, and which extra benefits might be included, all in a way that's easy to follow so you feel confident about whatever choice you make. We'll start by getting a clear picture of your unique situation, not just your current health needs, but also what your budget looks like and where you'd like to be a few years down the road. From there, we'll walk you through options that in many cases have helped people save hundreds, sometimes even thousands, without sacrificing the coverage they actually need. You have options. Don't let these Medicare supplement premium increases overwhelm you and pick away at your retirement savings. Here's what you need to do today. It's a really simple step. All you got to do is call 1-800-924-4727 or head over to our website at www.seniorbenefitclient.com to schedule your free Medicare review. There's no pressure, no sales pitch, just thoughtful, personalized guidance to help you make sense of your options and maybe even find some real savings along the way. And hey, if this video helped clear up a few things or gave you a better handle on what's going on, feel free to tap that like button. It helps more people find the information they need to. Subscribe to our channel for weekly updates, expert insights, and actionable strategies on all things Medicare. And most importantly, share this video with anyone you know who is on Medicare or approaching Medicare. Empower your friends and family with this knowledge to help them stay informed and financially protected. Thank you for watching. We are absolutely committed to helping you make the best Medicare choices for your future. We'll see you next time.